Lung cancer. Billy Bob is a 45-year-old man who has been a heavy smoker for 25 years, averaging about 2 packs a day. Lately, he has been experiencing difficulty breathing and his wife has commented on his wheezing. His doctor, after running a CT scan and a PET scan and finding a coin-sized growth in his chest, has told him he might have pneumonia and has prescribed him antibiotics.
The normal physiology of the lungs. Air goes through the trachea, through the bronchioles, and into the alveoli. Carbon dioxide is exchanged at the alveoli and is exhaled. Oxygen is also exchanged, attaches to hemoglobin in the red blood cells, and circulates to the body. The pH in the body is between 7.35 and 7.45. The lungs can quickly control an acid-base problem by breathing faster and exhaling carbon dioxide if it is too acidic, or breathing slower and retaining more carbon dioxide if it is too basic.
Unfortunately, the antibiotics did not help his coughing or breathing, or difficulty breathing, so he returned to the doctor, and after running another CT scan and a PET scan of the growth in his chest, it had not only grown in size, but other growths were also evident elsewhere in his body. After numerous tests, Billy Bob was diagnosed with small cell lung cancer.
Signs and symptoms. The expanding lungs, which is caused by the extra cells, will push on the airway and tissues, causing a wheezing sound. The immune response will cause swelling, which will make it difficult to breathe. The immune response targets the cancer cells, and as a result, cancer patients run an ongoing fever. All of this requires a lot of energy, therefore, the patient experiences weight loss. For risk factors, number 1 is smoking. A higher risk depending on how much they smoke and for how long. This is measured in something called pack years, how many packs they smoke a day multiplied by how many years they've been smoking. Number 2 is radon. It's naturally occurring gas found in the atmosphere. It's formed by the breakdown of chemicals in the soil, and in high enough concentrations, it can cause lung cancer. This often builds up in basements. And number 3 is medical imaging radiation, and it can be harmful to the cells.
So diagnosis. Billy Bob was diagnosed with small cell lung cancer, which is characterized by a distinctive cell type, small to round oval cells that are the size of a lymphocyte. These cells grow in clusters. Small cell lung cancers are highly malignant and in 70% of cases have metastasized by the time of diagnosis, like with Billy Bob. This type of lung cancer has the greatest link to smoking. So Billy Bob's diagnosis was no easy feat. He had to undergo a rigorous physical examination, which included a chest radiography, bronchoscopy, sputum sample testing, and a biopsy of his lung tissue. He also had to get numerous CT scans, MRI studies, and ultrasonography tests done to locate lesions and determine the extent of his disease. Billy has what is called an extensive disease because it exceeds the boundaries of his lungs where it originated.
So lung cancer and how it affects the normal. One of the epithelial cells in the lung lining can mutate and reproduce uncontrollably. These cells take up space, which makes gas exchange difficult. It may be hard to move bacteria past these cells. This bacteria can cause infections. Fluid follows these white blood cells into the lung tissue, and lung tissue is going to expand with all this fluid. This fluid pushes lung tissue into the airway, which causes difficulty breathing. Lung cancer can cause metabolic acidosis, since not as much air is being exchanged, and therefore carbon dioxide can build up.
Treatments. Complete removal of the diseased lung has the greatest potential for prolonging life and providing a cure. But in Billy's case, his cancer is metastasized or spread throughout his body, so radiation and chemotherapy are the only options, but this has low success rates. There are new therapies on the horizon, including antibodies that target specific growth factors or other molecules required by the tumor or that deliver toxic agents directly to the tumor. There are cancer vaccines to stimulate the immune system to fight the tumor, and various gene therapies to replace the defective genes that make tumor cells divide continuously.
Now for key concepts. Homeostasis is the extra cells in the lungs take up space and impair gas exchange and the lung's ability to expel debris. For proteins, enzymes eat through the lung tissue, allowing cancer cells to move further into the lung tissue and multiply there, so they metastasize. And for the cell membrane, gas exchange occurs in the cell membrane of the alveoli.
Created using Powtoon.